Welcome back, everyone. It is a Medical Monday, and we're not just talking headaches, we are talking headaches and kids. Dr. Wendy Anderson Willis is a pediatrician with Nationwide Children's Hospital, and I think it's always, Doc, a little more scary when we're talking about kids because you don't know if it's run-of-the-mill like adults or if there's something really wrong. So start with us talking about the triggers. I thought this was very interesting. What causes them? Adults, it's stress, not sleeping, poor diets. What about kids?
I think there's some similar things with kids. So many kids don't get enough sleep at night. A lot of kids skip meals, and that's a big one. They don't have breakfast. It's lunchtime. They've already been fasting for, say, 7 o'clock until 7, and then another 4 hours. Their sugars are low. They get headaches that way. Too much screen time. I mean, you name it. There's so many different things that trigger headaches in our children.
Okay, and I am seeing sickness and stress on there. So
absolutely. When a kid has a cold or a virus or something is going on, oftentimes they'll have a headache along with it.
Okay, talk to us about the last two, which I wasn't sure what to do with that information. One was the menstrual cycle for girls.
Yes.
Yes.
Changes in those hormone levels can cause headaches for a lot of women, a lot of girls.
Okay, and what about these vision changes?
Oh, that makes sense. Henry with glasses.
Yeah.
Yeah, we have a lot of kids who are supposed to wear glasses, but I guess they don't think they're cute enough. And they won't wear their glasses, so those vision issues cause, lots of headaches.
So how do you narrow it down? You know, your child comes to you and they have a headache, they're complaining. It's hard sometimes for a kid to tell you where exactly in their head it hurts.
Absolutely. I think if they're having one headache and they have an illness and you're just kind of treating the illness, that should also help to make the headache go away when they're feeling a lot better. Sometimes we give them medication. You know, we don't use aspirin in children.
Right.
Anyone under 18, we don't use aspirin because it can cause Rye syndrome, which is a really bad viral syndrome. So we just use Tylenol or Motrin, but mostly it's a lot of rest. It's making sure they have something to eat and just sort of a quiet room and just let them take a little time to sleep.
I know in the summer months, dehydration is huge.
Oh my gosh, yes. We have to make sure they get enough fluid. So a dehydrated kid is probably one that's really at risk for developing a headache.
Okay, I saw two other things on that list too. You mentioned Imitrex. I don't know that I know what that is.
Oh, that's a migraine medicine, which I suffer from migraines.
Yes, we have lots of kids who have migraines, actually, when we look at the numbers overall. So we do sometimes get to the point where we do need to use Imitrex once in a while. So for most of the kids who have migraines, recurring headaches, they definitely have to see their doctors. If you're having headaches less than once a month, then I think most parents can handle that at home. But if it's more than once a month, we definitely need to see that child.
Okay, so that's kind of your parameter for when it could be something a little more than the average headache?
Absolutely.
More than once a month?
More than once a month.
Okay, so what about seeing a doctor? You know, when is it? I think you mentioned that. I mean, obviously the frequency. Any other big signals?
There's some other worrisome signs. So if the child has a stiff neck, if they're vomiting with the headache, if they have the headache upon awakening, first thing in the morning, or the headache wakes them up in the middle of the night. Those are things that we worry about. There are other things that give us signs that there could be some kind of brain tumor or there could be some kind of infection going on. Sometimes kids have recurrent headaches where they're having them, you know, maybe more than 15 days a week. We need to see those kids. Sometimes there's depression going on and other major issues that we need to treat.
You know, when you find with kids, especially the younger ones, a lot of this is psychosomatic too. So you have those issues to deal with.
Absolutely. We have many kids who are stressed. You know, there are lots of things going on with families. For many kids, there are things like OGTs and SATs and things where they really want to live up to our expectations, but it can really take its toll at the same time. So psychosomatic issues are huge when you think about pediatric headache.
Wow. You've got a lot to sort through.
I don't
know how you do it. But
I know, with kids it's tricky. It's the call from the school nurse, right? I've got a headache, Mom.
Right.
And so if the kids do have headaches and this is an issue, that can, I would imagine, obviously interfere in learning and focusing and all of that.
Yeah, it's really difficult. That headache kind of comes first and blocks everything out. So we certainly have to make sure that we take care of them. And what I really do when kids come in, we talk about their days. What is your day like? If they tell me they're skipping breakfast, if they tell me that what they're eating is, you know, are things like, you know, caffeine, like all the time, and if they don't have caffeine, they get a headache. Those are the kinds of clues that we're looking for. So we often have them do headache diaries. Okay. So if you have a headache, write down everything you've been doing for the, you know, maybe the 8 hours before the headache and the rest of the day, so we can figure out how to stop these.
Okay, well, thank you so much. I think you should do a headache diary too.
I think I will.
I just want to hear about your days.
Lisa.
you so
I'm so
much,
kidding.
Doc,
Thank you.
for taking care of our kids and their headaches.